Here is another nice, perfectly cylindrical shaped core of a kidney tissue. And the reason why it's cylindrically shaped is because it came out of a needle, because this was a needle biopsy in which we are only going to see a small part of the kidney rather than those nice broad slices that we saw from autopsies. Instantly, you could see that we see some glomeruli here, here, and the rest of these are pretty much tubules and blood vessels. But there's something very, very disturbing about these glomeruli, other than the fact that they don't at all look normal. This may look a little bit normal here, kind of nice and tufty, and you could see little tiny blood vessels. But these are, for the most part, pretty well scarred down, aren't they? And not only are they scarred, but they're kind of scarred in a funny way. They're scarred in a way that most of the scar tissue looks like it's shaped like a little moon out here at the periphery. And for that reason, this type of glomerulonephritis, which is called rapidly progressing glomerulonephritis, is perfectly synonymous with the term crescentic glomerulonephritis, because the fibrous proliferation is along the surface of the glomerulus and looks like a little crescent. This is the best one. This is not quite so crescentic, but you could see that it's similar in color and texture centrally. Let's see if we could find a better crescent, because we have a lot more areas we could go to. Could we see a crescent over here? Maybe there's a little more fibrosis out here towards the periphery. And let's go to another random area, because I'm really dying to find you a really, really good crescent. And this, what was once possibly a glomeruli, you could see almost the entire glomerulus is fibrosed. But let's find one where the fibrosis is primarily crescentic shaped at the periphery. And I know what you're thinking. You're probably thinking, well, why should a rapidly progressive glomerulonephritis look like crescents? And I think I could answer that question. I could answer it better if I could actually find another crescent. No, we'll have to do this the easy way and look at lower power. Is this one over here? Maybe. Let's see. The reason why you have crescents is if you have a severe glomerulonephritis in which there is leakage of proteinaceous fluid out of the glomerulus because the glomerulus is damaged, it actually stimulates the cells of the, not the visceral, but the parietal cells of Bowman's capsule. Remember, the visceral cells are actually the podocytes, but the parietal cells line the outer layer of Bowman's capsule. Well, that's why the fibrotic reaction occurs, because in a rapidly progressive situation where there is significant leakage material out of the glomerulus, it evokes a reaction in the parietal cell layer of Bowman's capsule, and that's where the fibrosis occurs. And you can see it. This is the best crescent I've seen in this area, at least. Perhaps in this one, you see it a little bit towards the periphery, but I have a hard time convincing you it was a crescent. But in this case, this is a perfectly nice quarter moon over here. Thank you very much.